Hi, I am Dr. Shweta Shah, a gynecologist, a laparoscopic surgeon, founder and director त्वमेव क्लिनिक मुंबई। आज के इस वीडियो में हम समझने वाले हैं everything about semen analysis and its report. Now this is a very basic and a very important test when considering pregnancy planning because male factor infertility accounts for about 50% of infertility. It is absolutely normal for the male partner to be stressed, anxious, nervous and feel awkward before giving the test. This should not be used as an excuse for not doing the test because it will not give clarity to your treating doctor into the exact cause for infertility. Before giving the sample, few parameters the male partner should bear in mind so that the report is normal and an authentic one. The test should always be performed in a lab and a home collection should be avoided. This is because the sperms are the most temperature sensitive creatures and they should be immediately processed as soon as they are out of the body. The male partner has to observe an abstinence or avoid masturbation or having intercourse for a period of about 72 hours. If this is not followed, the reports can be faulty. Thirdly, the test should be performed in a fertility clinic as there these reports are run day in and day out and therefore the probability of a report being authentic is more. As soon as you get the semen analysis report, it consists of lot of numbers and now I am going to tell you how to interpret all of them into normal or abnormal. Most labs have their own reference values and guidelines which will allow them to label the sample as normal or abnormal. Majority of the labs follow the WHO guidelines and I will walk through them step by step. Now the first and the most important parameter in the semen analysis is the volume. Semen does not only contain the sperm but it also contains the various secretions that are secreted along the way in the male reproductive tract. The normal volume is anywhere between 2 to 5 ml. If the report documents a low volume, the causes of it could be a faulty collection, missing the cup or not giving the entire sample for examination, and thirdly, it could be a blockage in the male reproductive tract, most commonly seen in the vas deferens. The second important parameter is the sperm concentration, which means how much sperms are actually present in the entire stuff that is given for examination. The normal sperm concentration is reported in millions per ml and the normal value is about 15 million per ml. If the count is low, the causes again could be a faulty collection, not following the directions of abstinence as advised by your doctor. Thirdly, any kind of illness which can be acute or chronic. Chronic illnesses most commonly like diabetes, obesity, and acute illnesses include any kind of recent viral infection, fever, cold, cough, pneumonia, COVID, etc. so on and so forth. But this low count is temporary and once the acute illness is gone, the counts may resume to normal. The other important causes of low count could be abusing substances like tobacco, smoking, vaping, chronic, regular, heavy and binging on alcohol. Social alcohol drinking doesn't affect the sperm count. Also, substances like marijuana and cocaine can severely affect the sperm count. Not only this, exposure to toxins like plastics, parabens, phthalates and bisphenols A, all these are found in the chemicals that we usually apply on our skin and other cosmetics. Daily use of hot tubs and sauna can also be one of the cause for reduction in the sperm count. This is because the sperms do not tolerate a very high temperatures for long, and it could result in destruction of these delicate structures. Also, a medical condition known as varicocele, which means dilatation of the veins in and around the scrotum region, could also increase the temperature of the testis and can lead to destruction of the sperms. There is one more condition which is known as retrograde ejaculation. So what happens? Whenever the semen is secreted, it travels all along the way through the reproductive tract, and sometimes there is a valve between the bladder and the area from where the sperms are produced. If that valve is faulty, the sperms may faultily travel into the bladder just before ejaculation, leading to a low sperm count. The last cause of reduced sperm count could be use of exogenous testosterone. Now, this is used by many males for increasing the libido, building the bodies, or for any other causes like tiredness, fatigue. This exogenous testosterone shuts down the normal production of sperms, leading to less count. It's like giving a birth control pill to the male partner. So if you are planning to conceive, see to it that you are not using any kind of exogenous testosterone. All these factors which cause reduction in the sperm count is temporary, and they can be reversed, but it takes about 2 to 3 months to return to normal. Next important parameter in the semen analysis report is the motility. This is always reported in the form of percentage, and the normal percentage of motile sperms should be about 50%. The motility is important because only those sperms which are moving can travel from the vagina up till the fallopian tubes to meet the egg, resulting in a successful pregnancy. All the causes which cause low sperm count can also cause less motility in the sperms, and these should be corrected as and when you recognize them. The last important parameter on the semen analysis report is the morphology. It is always reported in the form of percentage, and it is absolutely normal for 96% of your sperms to look abnormal, funny, or funky under the microscope. They may have double heads, double tails, disproportionate size of the head to the body, and that is absolutely normal. Abnormal shape of the sperm does not mean an abnormal baby or birth defects in the baby or miscarriages. It only reflects that an abnormal sperm has lesser potential to fertilize an egg. Thank you. For further such updates on women health, kindly subscribe to my channel and do not forget to press the bell icon. Bye till I see you next time.